Hello guys, and welcome to this video about aspirin. Aspirin is a really interesting drug that's used for 2400 years now, and I'm going to start by explaining how it works. So to understand aspirin, I'm going to explain to you briefly how inflammation works. So inflammation starts with a stimulus that causes disturbance in the cell membrane. And as we know, the cell membrane contains phospholipids. And when the cell membrane gets disturbed, it releases these phospholipids, which furtherly broke down into arachidonic acid by the phospholipase enzyme. And the arachidonic acid is either converted to leukotrienes by lipooxygenase enzyme, and these leukotrienes have different types, and the type which is B4 type has phagocyte attraction and cause inflammation. The other types of leukotrienes cause alteration in vascular permeability and increase in the mucus secretion and bronchial constriction, which leads to bronchospasm, congestion, and mucus plugging. Now, the other path of arachidonic acid breakdown is the prostaglandin thromboxane prostacyclin path, which is modulated by the cyclooxygenase enzyme. The prostaglandin cause alteration in vascular permeability and increased secretion, such as these leukotrienes, and also bronchial constriction, which leads to bronchospasm, congestion, and mucus plugging. The thromboxane causes leukocyte modulation. All these results cause inflammation. Now, aspirin works on cyclooxygenase enzyme. It inhibits this enzyme, and because of that, there is less quantities of prostaglandin and thromboxane and prostacyclin, which leads to less inflammation. Now, aspirin inhibits cyclooxygenase enzyme, and this includes both COX-1 and COX-2. Now, cyclooxygenase enzyme has more than one variation, and aspirin inhibits the first and second one of these variations. Now, it irreversibly inhibits COX-1 and COX-2. So aspirin irreversibly, this is an important keyword you need to remember because it might come in USMLE exam. The third point is it reduces the thromboxane and prostaglandin levels in the body, as I said in the previous slide. All right, now what are the uses of aspirin? There's actually more. There's 4 uses. I chose the important ones. There's also more. So first one is analgesic effect, and this is achieved by reducing pain sensor activity by reducing prostaglandin in the body, and it also modulated by a central mechanism that is not very well understood. Now, antibiotic effect, which is through reducing prostaglandin synthesis in the CNS. The anti-inflammatory effect, which I explained in the second slide of my presentation. And finally, the antiplatelet effect, which is through inhibiting cyclooxygenase enzyme 1 in the platelets. And by inhibiting this enzyme, there is a reduction in the thromboxane. And the thromboxane has a very important role in platelet aggregation. When it's reduced, there is less platelet aggregation, which explains the antiplatelet effect of the aspirin. Alright, now the dosage. The low dose of aspirin, which is less than 325 milligrams, works on platelet aggregation. The medium dose, which is from 325 to 1250, works as antibiotic and analgesic. The high dose, which is from 1250 to 4000, works as anti-inflammatory. Now, the adverse effects of aspirin use include increasing bleeding risk because of the antiplatelet effect that I talked about earlier, the gastrointestinal complications, which is through inhibiting cyclooxygenase enzyme 1 in the gut, which is responsible for the cytoprotective mucus secretion, which when we use aspirin, there is a reduction in this cytoprotective mucus, which leads to gastrointestinal complications. Now, increased renal risk, and that's achieved by impairing the prostaglandin-induced inhibition of both the reabsorption of chloride and the action of antidiuretic hormone, which leads to salt and water retention. Also, this leads to potassium retention because of decreased availability of sodium in the distal tubule. And there's another point that I want to talk about, which is inhibition of cyclooxygenase enzyme 2 that contribute to the regulation of renal medullary blood flow, which may lead to a rise in blood pressure, which leads to renal risk. Now, finally, the Reye's syndrome, which is a severe and often fatal disease that is characterized by the acute onset of encephalopathy, liver dysfunction, and fatty infiltration of the liver. And Reye's syndrome is associated with aspirin when it is used at people who are younger than 20 years old and have viral associated fever. So that's why aspirin use is contraindicated in this group of people. Now, finally, I want to talk about the excretion, which is, in case of aspirin, is renally excreted, and it is first order at low doses and zero order at high doses. Thank you very much for watching. I hope you learned something. Also, if you like this video, please hit the like and subscribe for more.